Hi there and welcome to MiWeek. I'm Christy McDonald. Thanks so much for joining us. There is a lot going on this week, including that big vote in Washington to repeal Obamacare. Governor Snyder is sending out a few warnings in anticipation of that vote of what could happen to people who depend on coverage from the Medicaid expansion here in Michigan. We'll talk about that. Plus, we are going to take a closer look at why people in Michigan don't trust government, what the most crucial issues are in the state right now. It is a pretty interesting look from the Center for Michigan, and that's coming up for you also. But let's bring in Nolan Finley of the Detroit News and Stephen Henderson of the Detroit Free Press to get things started. And I love it that you sit up straight when I say both of your names. That means you are ready to go and that you're paying attention, ready for the show. Hey, but let's go ahead and start in Washington, where there's a lot of wheeling and dealing and last-minute deal-making, I guess, to see if they can get health care done the way the Republicans want to do it. Nolan, let me start with you. What was the significance of Governor Snyder sending out all of those letters to the congressional delegation saying, hey, you might want to think twice about this vote?
Well, I mean, I think Snyder had no choice. He's got a Medicaid program here that he can't manage. I mean, the costs are going up much faster than he anticipated. He counted on the federal government paying a big chunk of it. This new bill would cap the Medicaid payments and would not pay for future growth. So, I mean, he's caught in a hard place. He's going to either have to drastically revamp this program or convince Congress to preserve it. I doubt the Michigan delegation will buck the party leadership and heed Governor Snyder. I think, for the most part, other than Justin Amash, they've all agreed to vote for this bill.
What did you think? But he had to write the letter anyway, even though maybe how it was going to fall out?
I think he has to write the letter, and I think it's a good letter. It makes a very important point, which is that people in all of these Congress people's districts are the ones who are going to suffer from the changes that are in this bill. I mean, the Republican criticism of the Affordable Care Act is that it raised costs for lots of middle-class families, and that's true. Their answer to it is to strip coverage away from the poorest families, from the older people, from the most vulnerable. And why is that more acceptable than what we have is the question that I think they need to all be asked. And I do think that I think they won't break ranks with this, but I do think that the consequences, if you vote for this and it becomes law, the consequences of taking this away from people who don't have other alternatives would be pretty bad.
Well, the consequences of letting Obamacare collapse is also going to be great, and that's
no one's proposing that.
Well, if nothing's done, it'll collapse.
Well,
we already have insurance
that.
bailing out, and the consequences of implementing Obamacare were pretty great on these politicians too, and they're mindful of that. I'm not sure that's an accurate description when you say stripping away. It changes the way people will be purchasing insurance, and it changes the program, but the program has to change. Now, I think but
if you take Medicaid away from people, what's their alternative?
You're capping Medicaid, and you're forcing these governors and states
so what are they going to
come up with different programs.
So what do they do?
You can give them the tax credits, you can give them
poor
the
people
subsidies,
with tax credits.
the subsidies that are in this bill for poor people. You just have to limit the expansion, or we're not going to be able to pay for it.
It's nonsense.
It's going to eat up the state budget, Steve. Well, we just can't have an unlimited entitlement.
Well, and that's going to cause some larger problems as well.
Medicaid was never intended to be a middle-class program.
It's not a middle-class program.
It's becoming that way in Michigan and other states.
The reason it's becoming that way is because more and more people work jobs that don't provide health insurance, and so they need government assistance.
This is unsustainable. The growth is going to eat up the state budget, and the federal government cannot make the changes it needs without capping these Medicaid
All right,
payments.
so this is going to be heading through the House tonight, and it's probably going to be late. And we are taping the show a little bit earlier than I think what some of this voting is going to come down to. But then it's going to take on maybe a life of its own in the Senate.
Yeah. Well, and where you've got cooler heads, than you have in the House. You don't have this crazy caucus, the far right caucus that wants to trash the bill more than this does.
Well, they don't want to pass the bill.
in the Senate. I think this has less chance of passing the Senate than it does of passing the House. And if you move it to the right in order to get the votes that you want in the House, you even give it a slighter chance in the Senate. The problem is that the president made some promises about what would happen if he changed the Health Act, that people would still get covered. And this bill doesn't do it. It doesn't even come close. It's going to push all kinds of people back into that non-insured category. And if you think that's, A, if you think that's a fix, I think there's something wrong with you. B, if you think that's politically saleable, you're insane. It's just not going to work.
It returns the insurance market to free market principles, and if competition
free market
drives down
principles
the
that left 40 million people uninsured.
And you still today, you've disrupted the whole insurance market. You still got 30 million uninsured.
That's not true.
So,
you have 8 million uninsured.
You have 30 million uninsured, and you did not accomplish the goal.
30 million. It's down to 8. What are you talking about? Where did that number come from? 30 million.
Fact check that number.
That's not right.
It's
That's
30
wrong.
million.
It's 8 million. It's the
30.
lowest it's been in 70 years.
All right, we're going to Google that in a minute, and we're going to come back, and we're going to have to
What are you
prove
talking about?
both
30
of you
million?
wrong. Someone get me a phone so I can do that in my
Great.
spare time. I'm going to move forward, though, on a couple of other headlines that we saw this week before we get into our main story talking about trust in government. Nolan, you've been keeping a close eye on the superintendent, I guess, watch at Detroit Public Schools, and we kind of got the finalists. There are 3, and those names did not include Alicia Merriweather, who's the interim.
Yeah, I think that's a shame, because Alicia Merriweather, whether she's would have been the best candidate or not, I certainly think the work she's done merited her being a finalist, and she's built a lot of good relationships in the community, with the business community in particularly. She's been open to some of the reform ideas. She's got a fairly decent rapport with the governor's office. I think she's done a good job, and I think based on her performance so far, she should have at least made the final cut.
Interesting. You have someone from Florida, also from Milwaukee, but then locally you have the head of the River Rouge School District.
Yeah, I mean, I'm not sure. We don't know enough about the finalists yet to, I think, talk about why they were finalists and what they might offer the district. I do think that the board made a terrible mistake in not placing more of a premium on stability. That's the main thing that Alicia Merriweather has been able to accomplish, is just bringing some normalcy to the management of that district, which is something we haven't had in more than a decade. And so the idea that you would toss her aside in favor of 3 others who automatically mean disruption, no matter what it is that they're going to do, they would be a disruption in that continuity. It doesn't make a lot of sense to me, and I think.
Do you think they felt they had to because she was the governor's appointee or the emergency manager's appointee?
I don't know what they were thinking. I mean, I think
you
part
have the
of
teachers' unions who are backing her and that want her back
and the
in
parents
that final.
I mean, part of the problem is that you've got this new board, and I think they're eager to show that they're in charge and making decisions. I think the smarter path might have been to wait a year on the superintendent search. You have somebody in place who's doing a decent job, let that continuity sort of sink in, and then come to that decision. They were eager to do it right away to put their stamp on the district, which I think is probably an error in judgment.
All right, and what did you see this week, Stephen? You were talking about?
Well, J.P. Morgan says that it is impossible in Detroit and New York to live your life and shop within 20 minutes of your home, which is sort of the ideal for urban scale. That's what we always sort of talk about, that can you have that 20-minute life where everything you need is within that bubble. Detroit is not getting close to that, but also New York, which is a city that we think of as a model for sort of urban scalability.
You can find anything at any time.
that they're having a hard time doing it there as well.
Because you can't get anywhere in 20 minutes in New York.
Well, I mean, right. You have different dynamics at work. One of the interesting parts of it here in Detroit is that it's harder for low-income people to do it than middle and upper income, and that's where we're having the problem. That poverty and isolation that's taking part of the city is playing out there too.